Good afternoon, everybody. My name, as Molly has introduced me, my name is Katanya Arnick. I'm the CEO for the Center for Youth Wellness. I wanted to thank everyone and welcome everyone and thank everyone for coming today and spending time with us. So we are going to be diving into ACEs screening, cultural and racial differences. We're also going to be exploring or talking about ways that you can also, you as a practice or an entity and an organization can address ACEs and toxic stress through screening when there are racial and cultural differences amongst your staff and also the community in which you serve. So a little bit about the Center for Youth Wellness. We were founded in 2012 by California's first and current Surgeon General, Dr. Nadine Burke-Harris. We're located in San Francisco's community of Bayview Hunters Point. The Center for Youth Wellness, or what we like to call CYW, has led the conversation in addressing adverse childhood experiences, or ACEs, and toxic stress through screening, interventions, and building resilience. We have also implemented an ecosystem of care model with community partners that knit together clinical services, family support, social service coordination, as well as community advocacy. We continue to address and heal toxic stress through a co-located partnership with our longtime partners, Bayview Child Health Center. So I mentioned the ecosystem of care model CYW has developed in a way for us to address what happens after you screen an individual, right? And so what we envision is a way to build strong partnerships with communities and families that really look at whole person-centered care and offer wraparound services. And so if you'd like to, let me take a step back, that really looks at whole person-centered care, where we use technology to eliminate and minimize barriers to care, where we create a more supportive network for entities that are also supporting that family, where we create systemic change through advocacy, policy, and intentional relationships, where we use patient-centered evidence and patient-centered and evidence-based interventions to help that family heal from toxic stress, as well as looking at a family's racial and cultural backgrounds and gender identity, and then doing work around equity and social justice. And if you're wanting to learn more about our ecosystem of care model, I think Molly's going to put the contact information to Center for Youth Wellness in the chat. So like I mentioned before, today's objectives, we're going to briefly review the ACEs science. We're going to discuss implications of ACEs screening and long-term health outcomes. We're going to review motivational interviewing and trauma-informed care principles in a practice or an entity, and why they're so important when working in a culturally and racially diverse community. We're going to also provide a case study for the implications of how racial and cultural differences may prevent screening for ACEs and how to overcome them. So let's take some time to kind of ground ourselves on a couple of definitions. So let's look at the definition for toxic stress. So according to the National Academies of Science, Engineering, and Medicine, toxic stress is defined as prolonged activation of the stress response systems that can disrupt the development of brain architecture and other organ systems, and increases the risk for stress-related disease and cognitive impairment well into the adult years. And so you ask, well, why is that important to talk about? What is the definition of toxic stress? Well, because toxic stress and adverse childhood experiences are two very different things. And we've had folks ask us, well, if I have a high ACE score and my child has a high ACE score, doesn't that mean that we just have toxic stress? Not always. And we'll talk about what those interventions are that families can incorporate to mitigate the effects of toxic stress. So what happens is a child may go through an ACE, or a person may go through an adverse experience. And depending on how much that stress-related response continues to happen in that body can create toxic stress. So ACEs and toxic stress are co-related, but are not the same thing. So let's look at adverse childhood experiences. So what is an ACE? ACEs are potentially traumatic experiences that happen before the age of 18. The term ACE comes from the Adverse Childhood Experience Study, or the ACEs study conducted in 1998 by Dr. Vincent Felitti and Dr. Robert Anda. The study is the basis for 10 core ACEs, often separated into 3 categories. And as you can see on this slide, the 3 categories are abuse, which include physical, emotional, and sexual abuse; neglect, which is physical and emotional neglect; household instability, mental illness; incarcerated relative; mother treated violently; substance abuse; or divorce. And I'd like to just note that this is just my own personal observation, that those household instability events also seem to prevent or provide instances where a parent may not be present or active in providing buffering care for that child. And we'll talk about that a little bit later. The other thing that the ACEs study helped reveal is that ACEs are incredibly common, especially among all of us in a population. But according to the California Surgeon General's December 9th, 2020 report, 61.6% of US adults have 1 or more ACE, 15.8% have 4 or more ACEs, and 62.3% of Californians have 1 or more ACE, and 16.3% have 4 or more ACEs. One of the other things that we recognize and know is that there are additional adversities that families and children can endure that can also create toxic stress or create that toxic stress response. Those additional adversities can include community or school violence, experiencing racism, social injustice and discrimination, homelessness or housing instability, food instability, separation from family through either foster care or immigration or deportation, a caregiver's serious illness, or a caregiver's death. One of the things that I'd like to add onto here that is not on this slide is that COVID-19 has also created an additional adversity that can create toxic stress for our families. And so we know that COVID has created additional stress response for many of us, but especially during this pandemic, especially communities of color, especially Black communities. And we'll touch on this a little bit later in the presentation as well. The other thing that we've known is that when you take an ACE or an adverse childhood experience and then an adverse community event, they're called the pair of ACEs. And in this demonstration, or in this illustration, it demonstrates how they can interact and reinforce one another. And so personal experiences are not the only things that can affect your health. Community adversities can also affect your health and create a toxic stress response. There are, like we said, 10 core ACEs, but a person's environment can also affect their health and their exposure to toxic stress and other adversities. So what kind of happens when a family or a child or an adult goes through toxic stress or has that consistent, regular, frequent exposure to ACEs and creates that stress response? We know that it causes the body to have a biological response where your stress response is always active on a consistent basis. And when we talked about earlier about a buffering adult or that household instability where there's a parent removed or could be removed from the household, that's less of an opportunity to provide a buffering caregiver for that child as they're going through an ACE or as they're experiencing an ACE or experiencing some form of toxic stress. And what we know is that it will sometimes manifest itself, that toxic stress response will sometimes manifest itself in these clinical symptoms. And you'll see things like diabetes on here, difficult keeping weight on, frequent abdominal pain, difficult sleeping or nightmares. You'll see self-harm, suicidal ideation or attempts, infrequent infections such as ear infections or pneumonia, colds, eczema, flaring, so on and so forth. And so I wanted to spend a little time on this slide so that you can see how toxic stress without a buffer or without interventions can sometimes manifest itself in a child or even in yourself as an adult. So who do ACEs impact? So we've already talked about the importance of screening. And so screening for Center for Youth Wellness is a way to acknowledge and prevent and start that family on healing toxic stress. And so with ACEs with the screening for ACEs as a preventative measure, and one of the steps to help begin to addressing and helping families heal from toxic stress, what happens when you have biases, or a family comes into a practice and has a distrust of the practice, nothing that you have done, nothing that your clinic or the team has done, but just has a dis-ease or an uneasiness about the practice. Or the the family has experienced inequities that's created roadblocks to screening a family. What do you do, right? So let's go back to this slide and talk about who do ACEs impact. So according again to the December 9th, 2020 California Surgeon General's report, ACEs impact all communities across the board, especially during this pandemic. But the pandemic has also kind of highlighted lots of systemic racism, lots of biases, lots of things that affect people of color, but especially Black Americans. And so some populations are affected disproportionately, and these populations are listed here. So individuals who are racially marginalized, so Black, Latinx, Native American or multicultural, high school non-graduates, unemployed or unable to work, populations in lower income brackets, uninsured or underinsured, people involved in the justice system, women, and then folks that identify as lesbian, gay, or bisexual. So ACEs dramatically increase the risk of 7 out of the 10 leading causes of death. And so you'll see here that heart disease, cancer are about 2 times more likely to happen when people are enduring high levels of ACEs or high levels of toxic stress, where they don't have a way of interventions or creating a way to buffer some of that toxic stress. You'll see chronic lower respiratory disease, stroke, Alzheimer's, diabetes, and then you'll see suicide attempts as well. But I will say that because of systemic racism, deeply rooted bias, an inherent distrust of the medical system and systemic oppression for communities of color, especially Black folks, ACEs affect those communities of color at a much greater level. And I'll say that that inherent distrust of the medical system is really part of the Black community a lot of the times. I'm not saying that all of the time that's how that happens, but a lot of the times that's how it happens. But let's understand, you know, the history of how Blacks have have been treated in the medical system. We've been experimented on against our knowledge. Our cells have been taken against our knowledge. The Tuskegee experiment ended in 1972. It started in 1932. It lasted for 50 years, 50 years. But the experiment ended in less than 50 years ago. And so there's a distrust there because there's a lot of places where I believe that there hasn't been acknowledgement, there hasn't been real conversation about ways to really pave conversation and trust and a safe place where communities of color, but especially Black communities of color, can come and feel really safe to be able to go through an ACEs screening. And when we talk about our case today, we're going to talk a little bit about how that medical clinic helped to kind of jump over a couple of those hoops around trust and safety. I'd also just say, because of COVID-19, the life expectancy has dropped. We're Black seeing the greatest drop in rate of 2.7 years, going from an average of 72 years as a life expectancy, are at 74 years of a life expectancy in 2019, going into a life expectancy age of 72 years in 2020 because of COVID-19. So what we know is that without intervention, there can be a 20-year difference in life expectancy. And so this is why for Center for Youth Wellness, screening for ACEs and toxic stress is a preventative measure, and it'll help us hopefully put this family on a path to start addressing their toxic stress in regards to those ACEs that family may be dealing with. So what are some of the scientific interventions that Center for Youth Wellness really looks at and employs and says, these are ways that families can help to buffer or to help to mitigate the effects of toxic stress? So we call this our 7 domains of wellness. But I'll also just put a plug and say at some point, hopefully we'll make them 8 domains of wellness, and I'll tell you what I wish that 8th domain of wellness would be. So the first one is supportive relationships, eating healthy, sleeping well, using movement or exercise, practicing mindfulness like meditation, supporting mental health, and spending time in nature. And my 8th that I would hope that at some point we can add on is spirituality or religion on that. And so we can prevent or reduce the exposure to toxic stress by screening. Screening coupled with a prompt intervention plan that includes 7 of these domains of wellness can help to reduce the effects of toxic stress, and a family can really start that path on beginning to look at healing. So what can your practice do, right? What can your practice do? What can you as an organization do? How do you support these movements? So let's look at what we call motivational interviewing. And I will always say, or I'd like to always say to my staff, let's try to meet the family where they are, right? And what does that mean? We're going to talk about that a little bit in a little bit. But motivational interviewing is a collaborative conversation style for strengthening a person's own motivation and commitment to change. CYW believes that motivational interviewing is key to help get past the distrust, create a place of safety and engagement for a family, especially for a family of color, or a culture or community of color in which you serve, while also using trauma-informed principles in your practice. So let's dive in a little bit more to what motivational interviewing is. So this is the OARS framework of motivational interviewing. You'll see the first step is open questions. Ask the patient open-ended questions and allow the patient to reflect and elaborate in responses to those questions. Let them do most of the talking. This is where I think I'd like to say this is the active listening stage. This will endure or hopefully build a place where the family, the patient, the child can create a safe environment. They can start to build a trusting and respectful relationship with their clinician or whoever it is that they are engaging with. Explore, clarify, and gain an understanding of the patient's world. So you as the person, the clinician, the social worker, the doctor, the whatever your role is when you're enduring or talking to a community of color or just anybody that's dealing with ACEs, it's important that you go through this open question stage because it will help you to get more clarity, to get more understanding of what's happening in the patient's world. Sometimes, or what I have seen happen, is that clinicians, because there's a cultural difference or because there's a racial difference in how families may raise or may interact with their families, what I've seen is that instead of going through this open question and allowing you to get more clarity and allowing you to get more understanding, there's an immediate assumption about what is happening to this child and what is happening to this family, and it may not quite be accurate. And so sometimes it's important that we take the time to gain clarity, to gain understanding, to really truly understand what's happening in that patient's world while also looking at what's happening culturally, what's happening racially for that family. The other section is the A stands for affirmation. So recognize and reinforce success, express a positive statement about what the patient has already done or a personal strength or ability. Show empathy for the patient's situation. And so what this will continue to do is help build rapport, help form the exploration into like the what's happening for that patient or for that family. Affirm that whatever the patient has done or whatever the family has done thus far is great. So affirm that, affirm the healthy behaviors and build the patient's or the family's confidence or self-efficiency. That's really important as you go through conversations, especially during screening, because the ACEs screening can be triggering and hard for folks to go through. R, reflective listening. So mirror what the patient is saying, rephrase what the patient says in their own words. And so what this will do will help to kind of take this family or the patient and help them understand and see that you're listening and that you're not making prejudgments or pre-assumptions about what that family or that patient is enduring and going through. Offer the patient the opportunity to hear his or her own words, feelings, and behaviors reflected back to him or her. And then they can also catch like, that's not what I meant. Let me rephrase that. Let me tell you that in a different way. Or that's right. That is exactly what is happening to me. And then S is summarizing. So apply reflective listening when closing the conversation and or transitioning to a different part of the conversation. Paraphrase and or paraphrase or pull out key points from the conversation. This again will help the patient or the family really get on the same page as we listed here, but also it will help them say, that's not what I meant. I meant something else. And then you guys can go back to the table and really talk about, really start having more open communication about what's happening with that family or that patient. Close the conversation with a plan of action. And it's important that, we'll talk a little bit about this, it's important that when you do a plan of action that you engage with that patient, that family, that child, to really start to look at what interventions can reasonably be included to help kind of mitigate the effects of toxic stress as you go through an ACEs screening. So help the patient see a bigger picture and highlight the most important elements of the conversation. Helping the patient see a bigger picture, I think, is important, especially because as you go through an ACEs screening, especially one where the patient the family may not know you, or the patient may not know you as well, it is important to engage them, open-ended questions, and help the patient see the bigger picture of why it's important and how this is going to help in the long run. So trauma-informed organizations. So one of the things that trauma-informed organizations do is that they realize the widespread impact of trauma, and they understand the potential pathways for recovery and healing. They realize the signs and symptoms of trauma in not only their families, their patients, but they also realize it in their staff. They respond by fully integrating knowledge about trauma-informed policies, procedures, and practices, and they try to not re-traumatize the family or the staff member that they are dealing with. So at Center for Youth Wellness at CYW, we took some time and looked at and continue to look at internal practices and policies, how we interact with our families. Where were the places that we created barriers to care? And then how do we eliminate those, right? How can we be better partners, not only with the community, but also with the families that we serve? And so ACEs screening is a big part of being a trauma-informed medical practice. So the principles of trauma-informed care, how does it show up in your practice? One of the ways is through safety. Are you creating a safe environment? Are your staff trained on how to de-escalate conflicts? Trustworthy and transparency. Develop a family-friendly roadmap of the care delivery model with the family, as well as, are you creating for your staff a trustworthiness and transparent place for your staff to be? Peer support, so developing support groups for families, youth, and patients with certain conditions. Collaboration and mutuality. Incorporate the voices of families as key stakeholders. So Center for Youth Wellness has a community advisory committee. We call our CAC. Their voices are extremely important to the work that we do with our families and in our community and as an organization. And then empowerment voices, empowerment, voice, and choice. So incorporate approaches such as family case conferencing and case plans that are strength-based. Cultural, historical, and gender issues. Staff trained, is your staff trained in cultural humility and the historical trauma to prevent re-traumatization? That one is important, again, when you serve a culturally and racially diverse community. It's important to not only understand and know the cultural, the historical culture, or the historical racial entities or events that have happened for that culture or for that race, but it's also important to understand what has happened in that community. So if you're serving a certain community, it's important to understand what's happened culturally, what's happened racially, what's happened around bias, what's happened around systemic racism, what's happened around housing instability, food instability. All of those things are really important, especially when you serve a diverse community or a culturally or racially diverse community, such as the one that CYW serves in Bayview Hunters Point. Bayview Hunters Point is mainly a Black community, but over the years, the demographics of Bayview Hunters Point has shifted a bit, but it's mainly a Black community. And it was important that CYW staff understand the culture and the community that we serve. So when you're looking at becoming a trauma-informed organization, what you're going to want to do is look at these 3 areas to focus on. So trauma preventative, are you creating conditions for safe, stable, nurturing relationships? Are you reducing the exposure to trauma as much as you possibly can? Trauma informed, are you raising awareness about trauma? Do you promote trauma-informed practices within your organization, within your practice, your clinic? Do you say that all of your staff have to go through some form of a trauma-informed training? Trauma specific. So are you increasing access to interventions and services that mitigate the impact of trauma? Are you promoting healing somehow through your practice and how you interact with the community in which you serve and how you interact with your coworker? Are you being trauma informed? So everybody likes looking at pictures of babies. So I said, let's talk about a story and let's use this picture. So this is Morgan. Morgan, like I said, this is an old picture of Morgan, but I figured since everybody likes to look at babies at 12 o'clock in the afternoon on a Wednesday, let's put this picture of Morgan up here. So Morgan's never been to a pediatrician where she or her mother have been screened for ACEs. But what we know about mom is that mom has an ACE score of 5, and Morgan has been exposed to homelessness, food instability, divorce, community and family violence, racism. And I'll say that Morgan identifies as a Black female. Mom identifies as a Black female and bisexual. The first time that Morgan's ever been screened for ACEs was during a visit to her PCP where she was going to get a physical done. And so at this time, mom already had diabetes and had an A1C. Well, mom had diabetes and at some point had an A1C of 13.2. And for those of us that don't know about A1Cs and blood sugar and what the equivalent is, an A1C of 13.2 means that mom's blood sugar was consistently in the 300s, in the mid 300s actually. So Morgan went into her PCP to get her physical done, and Morgan completed the de-identified ACEs screening. And so while mom also completed the de-identified ACEs screening for her child, Morgan's experience was with the screening and the physical, and also after having a conversation with her pediatrician, found that Morgan may be dealing with depression and anxiety and may not be processing sugar well. She may have areas of eczema as well. And as we know, these are some manifestations of toxic stress that a child may be enduring. So mom experienced, with completing the identified ACEs screening, mom was triggered. What does that mean? So mom felt like answering these questions may create a level of distrust. It caused mom a lot of stress to answer the questions. It made mom second guess how well she did as parenting her child, or how well she did at protecting her child when she was faced with the ACEs screening. And it was initially extremely hard for mom to answer these questions. So what mom did was tell staff. She told the nurse and the nurse practitioner, who is also Morgan's PCP, and she expressed how hard it was for these questions to be answered. Now let me caveat this by saying there may not always be a time where a family or a parent or a caregiver who's answering the ACEs screening questions feel comfortable saying, I don't feel comfortable answering these questions. I don't want to answer these questions, and here's why I don't want to answer these questions. This is why motivational interviewing, doing the open-ended questions, are really important at this time, because if the caregiver, mom, dad, whoever, is engaged in answering these questions in an open-ended way, it'll help to just kind of hopefully ease them a bit into these conversations. And so as mom expressed her discomfort and how difficult it was to answer these questions, the nurse and the nurse practitioner, again, the PCP for Morgan, met mom where she was at. So when I said earlier, we're going to meet our families where they're at, mom, the clinic staff, the nurse and the nurse practitioner did that. They encouraged mom. They asked open-ended questions to help mom reflect. They also recognized the difficulty in answering these questions. And then they said, they talked about how much of a great job she was doing as a parent. They considered the cultural differences and inherent distrust that mom may have when feeling, that mom may have been feeling, and they talked about it. They didn't shy away from it. They laid it out on the table and they said, look, let's have a conversation. And mom was interested and willing to have that conversation. So the other thing was that they really allowed mom and Morgan to lead the conversation, especially around that ACEs screening and what is happening in each of those instances of when mom had to answer those questions or when Morgan had to answer those questions. And so together as collaborative partners, they figured out, now that Morgan is 17, they figured out a way to create or to increase those interventions that we talked about earlier, 7 domains of wellness, to create a plan where Morgan could start to integrate those interventions into her life. So this is Morgan now. And Morgan, for those of you that don't know, is my daughter. She is 17, like I mentioned before. She currently is using meditation and time outside in nature, supportive relationships, eating healthy, exercising to mitigate the effects of toxic stress that she has been exposed to. My daughter would not have been using these interventions if one, she wasn't screened for ACEs. If two, she didn't go into a trauma-informed medical clinic. If she didn't feel safe in that clinic to even answer some of those questions. If she didn't feel like she had been listened to while she was answering some of those questions in the ACEs questionnaire. So my experience in the clinic allowed me to create a place of trust and safety. But I will tell you that for me, even as a CEO for the Center for Youth Wellness, who has to go into a PCP with her daughter, and even myself going into my own PCP, it was hard to complete that questionnaire because I don't know how I'm going to be viewed. I don't know how I'm going to feel. And it was the staff, the nurse practitioner and the nurse, who calmly and gently kind of walked me through that process, who recognized that there were cultural differences, that there may be questions, that there may be an inherent distrust of what's happening and why it's important for us to answer these questions. But I don't know that if these ACEs questions weren't screened for Morgan, I don't know that we would have came up with a plan that was so helpful for her and how she lives her life as a 17-year-old. I will tell you that the work is not easy and not all cases will work like mine. But if you take the time to be trauma-informed, culturally informed and sensitive, and educate yourself on the culture and the community and the racial differences in that community in which you serve, you can create a space of safety and trust, which will allow families to begin to heal from their toxic stress. And I will leave it for questions. I know, unfortunately, we have like 15, a little more than 15 minutes. So I will leave this time for any questions. And I think my colleague, Carissa Luckett, is here, as well as Molly. You guys have met Molly earlier, but we will leave it open for questions.
Great, thanks so much, Katanya. I really appreciate it. So we do have a couple of questions. The first one, I think I will throw it out to both you and Carissa. So it is about specifically about the expanded ACEs screening. So the Pearls tool has the 10 core ACEs, and then it has the additional, I think it was 9 questions about more community ACEs. And so the question was, if a person had, let's see, in traditional ACEs, if a person has 4 or more yes responses, that was a positive screen. What is considered a positive screen with this expanded questionnaire? So I will throw that out to both of you.
So even with the expanded questionnaire, a score of 4 or more is considered a positive. Utilizing the Pearls tool, which is a validated tool, the scoring algorithm has been proven to be effective as far as face validity. The questionnaire itself has been validated, but using the combination of the Section 1 and Section 2 scores is routine and is the recommendation in the Office of the Surgeon General's scoring algorithm, which is available on the ACEs Aware website.
Great. So another question, it says, we know that the trauma a person experiences before 18 from the hands of a caregiver impacts how you parent, but does the trauma experienced as a result of community factors in your childhood also impact your parenting in the same way?
As far as impact your parenting, I'm not completely sure what you mean by that. That it's a very interesting question, and it's a good question. The experience that individuals have in the community are certainly just as valid and as important as the 10 core ACEs. And it's also really important when you are approaching a patient family to approach them with a strengths-based perspective and recognize that the screening itself is an assessment of their perception. And so some families may actually report a higher ACE score, but they may have gone through a journey of healing already, and they may view those experiences not necessarily as a bad or negative thing, but something that they have prevailed through and learned about themselves and strengthened their own families. So I think it's critical to use that motivational interviewing technique or the techniques that Katanya spoke so eloquently about, and really see where the patient family is, see what see where they feel like their experiences may have impacted them, or whether or not they feel like they've experienced toxic stress around those. And if they don't feel like it's a negative experience per se, or maybe they just don't have an opinion about it yet, that's okay too. That's where it's important to provide a little bit of patient education, plant the seed of awareness about ACEs and toxic stress, and then move on. And the entire healing journey is rarely, if ever, going to occur in that single visit. So it's going to be something that you, as the provider or a behavioral health worker, can work with that patient family on as they allow room for that and are open to the process.
I'll also just piggyback onto that and just say that whoever asked that question, I think you also wanted to maybe try to understand that if you're in a certain environment, does that dictate how you are as a parent, or what type of parenting style you have? And I hope that's part of the question, because that's how I'm going to answer it. So I apologize if that is not. Please feel free to re-ask that question again. But I will tell you from my experience, I've as a single parent, I actually, I was in an environment where it was low income, high violence, and like food insecurity. It was kind of a food desert. There weren't a lot of grocery stores around, especially when I started off, and my child was very young at that time. She was a baby / toddler when I was living on the south side of Chicago. And so my parenting changed and shifted a bit because of the environment. So yes, the environment affected how I raised my child, how I treated my child, how I interacted with my child. One, because of the facts of like, I wanted to try my hardest to try and keep her safe, but I also realized that I couldn't be with her 24 hours a day, 7 days a week. So the environment did a little bit dictate how I was as a parent. Now, when I changed that environment and took her out of the south side of Chicago into a suburb, it again changed how I parented. So yes, in my opinion, this is only my experience, my opinion, the environment does also create, or maybe sometimes will dictate how you parent your child, just given what is happening around that child.
Katanya and Molly, there's another question, a great question by Shannon Wagner. It says, do you incorporate resiliency into the ACEs screening, or do you recommend following up the ACEs questions with resiliency questions? And I'll start off answering that, and then I'll turn it over to my colleagues. This is a great question, Shannon. We train practices to do this both ways. In a busy pediatric or adult office, screening for resiliency is something that is a challenge due to time and time in visits. We do have some practices that we've worked with that have added resiliency questions at the bottom of the ACE-Q questionnaire. However, most of the time we see practices utilize resiliency questions in a follow-up or in a follow-up referral to maybe behavioral health. And so there's no right or wrong way to incorporate resiliency. A brief way to address it in a primary care office is just to simply ask patient families, what have you tried in the past when dealing with stressful or difficult times, and to see what positive coping mechanisms they have, and then to educate them on which ones of those build resilience, and then encourage them to keep using them.
I'll also just say that in the story with my daughter, this nurse practitioner had a little bit of time and spent some time talking to my daughter separately from me, but spent some time talking to my daughter and asking her more resiliency types of questions. How do I know? Because apparently my daughter likes to tell me everything, which is great. I'm not going to shy away from that. I love it. But did spend some time. I will tell you that that's probably not, as Carissa has talked about, that's probably not a regular practice. This nurse practitioner also followed up after the initial time that she came in to see the nurse practitioner for that physical. She did actually follow up again with my daughter with a phone call so that they could just have a brief chat and just to check in, because again, sometimes that ACEs screening can be uncomfortable for folks to answer.
Great, thanks. I think there's one more question about research on community ACEs experience before 18 and its impact on parenting. I'm gonna, Carissa, I'm gonna throw that one out to you. I don't know, I mean, I don't know if we know any papers that we could throw out by name, but maybe you could, if there's some general research done on it. And then what I can do is when I send out the recording of this and the slides, I can include maybe some of the links to the papers.
Sure. I think there is ample research, particularly if you look at the references and the review of literature around triple P parenting. We know from our experience at the Center for Youth Wellness in training providers all across the nation and the world now, that parenting skills are really the most requested and agreed to resource that we utilize in a positive screen. So that thought about having a supportive parent or connecting with your child bonding, also attachment, is a critical concept in dealing with ACEs. And so, yes, having a supportive caregiver, who are most often, but not always, a parent, is really the most resilience building component in the domains of wellness, and other literature you'll see around stress busters or resilience builders. So absolutely, it can, depending on how a parent has dealt with their own ACEs and toxic stress, it can create difficulty in forming bonds or attachment, or sometimes it can it can cause a poor boundary setting. So again, it's all linked to the way people respond to their own ACEs, and that's going to be individualized for everyone. But there is great literature about that, and that was a really interesting question. So thank you for that. We appreciate it.
Great. Well, that's all the questions that I can see for now. So if you have any other questions, go ahead and write them in, but I'll take a look at it. And thank you so much, everyone, for joining us today. We will be doing another webinar in April around trauma-informed reopening strategies. So as things open back up, what does it look like to greet your patients and your everyone that you see that is part of your organization. So look out for that. I'll be sending out an invitation in the next few weeks. And thank you so much for attending today. And Carissa and Gatanya, I'll let you say anything you want before we close this out.
Go ahead, Carissa.
I just want to thank you all for participating. And please be sure to provide us your feedback via the link that Molly shared. It's very important to us. And I just want to thank our fearless leader, Gatanya, for all of her hard work on this presentation and sharing her personal story today. We appreciate it. She's a wonderful leader.
Oh, thank you. I didn't pay her to say that, guys. I promise you I didn't. But thank you all. Thank you all for joining us today, and I hope everyone has a fantastic week, and we'll see you next time.
Great. Thanks so much. Bye.